Dr. Getzoff, for those patients that are difficult to treat and the treatment are not successful, do you recommend nerve blocks? Pain,
I never have.
Or hip pain or knee pains? Do you recommend any nerve blocks?
I never have. No, I never have. I never recommended nerve block. In terms of that third scenario with the patient with calf pain, I think that's the most that the least scenario that you get. I think I've had maybe in a year's time I would get one person like that, where the other two scenarios are much more populated.
I'm going to ask Harvey first.
Yeah.
When you wrote their line 246, can you explain that to a dentist?
Oh boy.
It's hard.
Dr. DeJarnett, our founder developer, developed a system called occipital fibers where you palpate the ridge of the occiput, and there's 3 levels of fibers. Fiber 1 just means that basically, and he has specific charts to locate, so when you find a fiber along these 7 spots, you can actually reference it to specific vertebrae in the spine that are subluxated. So what you do, but line 2 involves the organ, see? So line 1 is the subluxation of the spine. It's a physical entity. Line 2 is that there's a relationship between the spine and the organ. And I think my interpretation is, I think it's the most popular interpretation, that it's a combination. The organ's affecting the spine's affecting the organ. So you treat the system. Now, Dr. Allen mentioned CMRT. That's the soft tissue reflexes that you do when you see a patient with a line 2 fiber. So we're actually feeding back into the system for the organ as well as making an adjustment to the spine. Is that right?
That's not a chiropractor technique, it's an SOT technique, right?
Well, we're all the same, right?
SOT chiropractic technique.
Yeah, that's it.
Yeah. There's so much research about possible interrelationships between organs and joints. That was begun by Louisa Burns in the 1930s, an osteopath, or even earlier than that. And then every year, ever since, we have a great researcher in chiropractic now named, well, he's retired now, but Charles Henderson, Gregory Kramer. There's many of them have shown specific irritations of certain spinal levels, like T6, will affect pancreas function. And so that's long established, and Dr. DeJarnett just found other areas that indicate the same thing.
Yeah, and when you know you have a line 2, you can feel it in the spine. If you have any palpation skills, it is there. And a line 2 feels different than a line 1.
And there's an article in the program book by Dr. Rome, who did a whole extensive study on somatovisceral relationships, and it's in the program book.
DeJarnett had some incredible people working for him. Dangerfield, Dr. Dangerfield, Ned Heskey, some really good people. Mm-hmm.
I'm going to ask Susan about chlorine dioxide. If I have to use it for myself, what is the regimen? If it's something simple that I need to know about it.
There's 2 products that you mix together. It's outlined in the book really well. You want to start at a low dose and build to, there's a chart in that book for what you want what's suggested for your weight. So it's actually really easy to find in the book. You find out how much you weigh, look it up. I'm on 32 drops a day, have been for like a year. It's helped my arthritis, things like that. So it's not only helping autistic kids, but it helps a lot of people. And the way it's written in here can just be, used for any pathogenic problem.
And is there any time that we stop? Do we know when to stop, or is this forever thing?
I'm probably going to take it forever because I've had 10 spinal surgeries and I have a lot of pain. But if you're loaded with pathogens, take it for a year, 2 years maybe, do the parasite protocol, clean yourself out. You probably could get by without taking it. It's super, super affordable too. So
The regimen for children is there too.
the regimen for children is in here, and then there's, with the dose the dosages are based on weight. So there's a really great index book, hooray, and you can find the index and figure out what you need on yourself.
I just mentioned earlier to Susan that in our office we've been treating some autistic patients, doing maxillary development, jaw repositioning techniques. It's simple depending on the behavior of the kids. We try to limit the amount of orthodontics we do. We do a lot of orthopedics, and some of the results are spectacular. And, you might want to consider adding it to your protocol with some of these kids because they have a tremendous amount of facial distortions.
Oh, absolutely. Something else I forgot to mention is that the thing that I like about this too is that the parents have something they can do at home. It's not just doctor dependent. It's not the kid comes in and gets worked on. You can do this every day and help your child yourself. And that, especially with autism, because they see their child regress and they lose them and they feel helpless, well, they have something that they can do themselves.
And I agree with Albert, is if that patient that you showed the case study, if the on orthopedic.
I've actually spoke to the mother about doing that, so
Yeah.
yes.
If you take the load of the mandible that's so protruded back, it will even help your posture.
Absolutely, yes, yes. I actually plan on incorporating that, so I know somebody else can help me with that.